So a lot of people ask me, can I see the robot? Here's the robot. Now, every patient gets to see the robot, but our anesthesia team, and they do an amazing job, they give you a little bit of medicine while you're still in the preoperative area, so that by the time you come in, you actually usually don't remember seeing it, so here it is. The robot consists of kind of three parts. There's the main base unit, that's where all the control system is. This large robotic arm that helps direct and stabilize the orthopedic instrument that attaches on the end, and it's sterilely covered with its own drape. And people ask, like, you know, what does the robot do the surgery? The robot does not. It's a passive robot. I'm not in the lounge drinking coffee while the robot's working. What it does is it sets up an invisible fence that I can make tiny adjustments on a computer. Those adjustments can be as small as 1/10 of a millimeter, much finer than I can see with my eyes or my hands. And then it sets up an invisible fence. So I'm standing by your side, the patient's side, during the whole case, and I'm moving the instrument on the end here with my own hands, and the arm just kind of follows along. And if for some reason I got outside of that perfect 1/10 of a millimeter plan, it just kind of stops with this invisible fence. So it allows me to be perfect every single time. One of the favorite parts of my job is that I get to work with a very small group of surgeons and engineers from across the world to help design the next versions of these robots. So in Europe, they don't really call their surgeons doctors. They're usually Mr. or Professor, kind of a European tradition. And so Professor Haddad and Catani and Lustig in the UK and Italy and France, Professor Sagano in Japan, Dr. Gavin Clark from Australia, and then Dr. Michael Dunbar from Canada round out the international group I get to work with, as well as some US colleagues, and of course a great class of engineers. We actually get to design the next versions of these robots and then bring them back to the patients here in Michigan, which is a super exciting part of this job. So there you go, you got to meet the robot, or if you've already had surgery, now you can at least remember what it looked like.